Hello, my name's Ian McCall, and this is a short video on a rather rare condition called lipoid proteinosis. We're really quite lucky in the Atlas in having several examples of this very rare condition, and I'd particularly like to thank our Middle East editor for submitting these cases, because they're all his. We'll come to them shortly. This condition is an autosomal recessive, and you see it in young children, usually before the age of 10. In fact, the very earliest feature you're going to get in lipoid proteinosis is a hoarse cry. So any time you hear a child with a hoarse cry, consider this as one of your differential diagnoses. Let's have a look at some of the cases. This is the latest one that's been put up. Our Middle East editor is Dr. Al-Sudani from Iraq, and he sees an absolute spectrum of very interesting and very rare diseases that really I just don't see in the West. So here's a lovely photograph of a little 6-year-old, and the features that he points out are these periorbital scars, depressed acneiform-like scarring. Now this is one of the later features of lipoid proteinosis, but what they get first is some vesicles and sometimes little blisters, and when they heal they leave these scars. In lipoid proteinosis you have a curious myxoid-like material which is deposited under the skin, and characteristically it'll be deposited along the edges of the eyelids, giving a series of little beaded papules. So if you see a child with hoarseness and little beaded papules along the eyelid margin, then lipoid proteinosis is your likely diagnosis. The other feature that they're going to show are mucosal lesions, and we'll show these in some of the other cases just in a minute. Typically, they're a yellowish-white infiltrated deposit and often seen on the inner surface of the lips or the undersurface of the tongue, and also around the fauces at the back of the throat and the uvula. And when they involve the tongue can be quite thick and woody. And sometimes you may even see the markings of the teeth, on the edges of this woody tongue. And it's quite difficult sometimes for the child to protrude this tongue. They often get a dry mouth as well, because there's involvement of salivary glands, and they don't secrete saliva properly. And indirectly, this then leads to problems with the teeth. They also can get some waxy yellow papules and nodules with a generalized thickening of the face, and we'll show that in some of the other later cases as well. And friction tends to lead to hyperkeratosis of the hands and the elbows, knees, buttocks, and sometimes even axillae. You'll get these verrucous lesions. They say that it's minor trauma that will lead to bullae, and it's these little vesicles of bullae that heal with these types of scars. Rarely you can get some scalp involvement, and that leads to an alopecia. And sometimes they'll get neurological deposition of this material as well, and that will give rise usually to epilepsy. However, come on, let's have a look at some of the other cases here. First of all, this little girl presented with hoarseness of the voice with many atrophic scars around the eye, 3 to 4 years duration. No similar family history. It's an autosomal recessive. So you're likely to see it if there's areas of consanguinity, where people marry cousins and things like that. Let's just have a look at this in full size anyway. And that's a lovely picture. You can see the atrophic sunken-like scars that there doesn't seem to be any little papules along the edges of the eyelids here. Let's look back at some of the other cases. We'll just go back and look at them in order here. Here's another case. Again, it's the face that you're going to be looking at. 4-year-old, acne-like scars. Again, toddler presented with hoarseness of the voice. The face had a waxy appearance. Let's just see if we can see that in the full view. No. It's difficult to get that feel. You can see the scarring up here, though. You know, these sort of atrophic type scars. And if you see atrophic-like scars over, say, the nose, then the other condition you've got to think about is EPP, or erythropoietic protoporphyria. That's a photosensitivity disorder. It's a disorder of porphyrin metabolism, of red cell protoporphyrins. And again, it presents in children, and it may present with some scarring, particularly over the nose, but they've got this photosensitivity element as well. We can't see if there's any eyelid lesions in this child. I can't remember much more about the history. That's much the same history as before, just these acne-like scarring and this waxy-like infiltrate under the skin. Let's go and see the others. Okay, this one looks a little bit more, it's a 9-year-old. And he's had lipoid proteinosis since the age of 2. And as Namir says here, he presents with a characteristic face, a great portion of which has been replaced with acne-like scars, giving the face a shiny, waxy appearance, hoarseness of voice, difficulty moving its weedy tongue. Let's see if we can look at that one in full mode. Again, you can see the atrophic-like scarring here, these areas here, over and you get a much better feel for, you know, this a sort of waxy, thickened, infiltrated face here. You know, if you look at these sort of ridges on the skin here, you can almost feel that waxy thickening. What other conditions can give you things like that? Well, we've mentioned EPP, erythropoietic protoporphyria, scleromyxedema. Again with a mucin-type deposit under the skin, amyloidosis, though it would have to be the systemic type, I think, to do that. There's another condition you can see called colloid milium. Looks a bit different to this, but it does give waxy, yellowish-like papules on sun-exposed areas. Usually in people much older, although you can get a childhood variant of this as well, colloid milium. But again, it's only in sun-exposed areas that they're going to get it, and they won't have the characteristic, which this guy doesn't have, the characteristic nodules along the eyelid margins. They won't have the hoarseness of the voice as well. So those differentials: scleromyxedema, erythropoietic protoporphyria, and colloid milium, and amyloidosis is another one to think of. Let's see if we've got a bit more in the way of other physical features. We mentioned about hyperkeratosis occurring. Here we go. In other areas, particularly areas of friction. Here's a 10-year-old girl. Let's look at these areas perhaps. Well, let's look at this bit inside the mouth first. We said that often there was deposition inside the mucosal surfaces, particularly on the lower lip. Let's see if we can see this full size. There you go. This material here is the material that we're talking about, deposited there on the lower lip. And if we look at this little girl's face, and then we'll look at those knees. Let's just see this full size. Yeah, you can see all of these marks here. Look at all this scarring, all this. Sometimes they're ice pick type scars, sometimes they're the more broad, diffuse sunken scars. Again, scarring over the nose here as well. Don't know if she had eyelid papules. Do they mention? Reflections of the written surface of the lower lip and the eyelids. Hoarseness of voice. Again, that's often the earliest thing noticed since the first year of life. Hyperpigmented plaques and extensor surfaces of both knees developed in the last year. Let me just see if we can see the eyelids here. A little bit difficult. You can see there's certainly some infiltration, but it's not the typical beaded papules that you'll see. Perhaps this, can't really tell from that. Again, the scarring though is well illustrated here. So remember those differentials: erythropoietic protoporphyria, scleromyxedema, and amyloidosis and colloid milium. Let's have a look at these knees. Okay, mixture of some atrophic scarring here, plus some hyperkeratosis from friction. And you'd probably expect that on elbows and the like as well, other sites of trauma. I think we've got one last case to look at of this, and then I'm going to flick into one or two of the books. Oh, this is an interesting one. 4-year-old, again, pitted acne-like scars, marked hoarseness of the voice from 1 year of age, waxy appearance, many whitish cream-like papules infiltrating in the surface of the lower lip and the dorsum of the tongue, pitted acne scars on the forehead and elbows. Certainly there's some of your scarring here. Let's look at the inside of the mouth here. Again, more exaggerated than that. Other little girls that we looked at in the inside of the mouth, these white infiltrated plaques here. You can see some evidence of it here on the outer surface of the lips. Let's have a look at these elbows. Yeah, not quite in focus, but again, you can get the feel of the infiltration here, a degree of hyperkeratosis here as well from this material that's laid in the skin. I'll flick into one of the Path books in a minute and just show you some of the histology. Let's see if this is going to show us more. Alas, it's always difficult to get a photograph of a child's tongue. You can see the white deposits here, unless it's not quite in focus, and you can see there are little white papules studied over the surface of it. Sometimes the tongue feels quite woody, and sometimes you can get indentations of the teeth at the edges. Big tongues can also be a feature of hypothyroidism, and can be a feature of, what's the other one, multiple myeloma. I think an amyloid can give you a big thick tongue as well. Okay, let's have a quick look at a couple of the textbooks on this. They're saying there's a lot of this in German and Dutch immigrants, but as I say, I think if there's a degree of consanguinity, as there may be with cousin marriages in Iraq, I think that might be why you get a few autosomal recessive disorders like this. They talk of it being defects in this ECM1 gene, which is related with, I think, mucin and glycoprotein production in the dermis. I'm not going to go into that in any great detail. Let's see if we can see eyelid papules in this particular case. I've been talking about them all the time, but I haven't really been able to show any evidence of one. Let's just see if we can, if this picture will give us a better image. Okay, let's see if I can make that just a touch bigger. There we go. Now, this is the sort of thing I was talking about. These are the papules. Look at these papules here along the eyelid margin. Same here. They look as if they're little warts, slightly hyperkeratotic there. They're not always as hyperkeratotic as that. But this is a characteristic, the beaded eyelid papules. And they talk about leonine faces. This is because of the infiltrate up here and thickening of the tissues here with the subcutaneous dermal infiltrate of this material, giving thickening and prominent markings here in the forehead, calling it leonine faces. Let's just go back. So those are the types of eyelid papules we were talking about. They just confirm this business of the weak cry or hoarseness because of infiltration of the laryngeal mucosa. That's why they get this hoarseness, and this hoarseness remains throughout life. Lesions usually appear in the first 2 years of life. And that first stage, vesicles and hemorrhage, and then the scarring, often associated with trauma, and then the ice pick or flatter type acne scarring. And they were just showing some verrucous plaques on the elbows. It's like that little girl where she had the hyperkeratosis. And the pathology here is basically thick deposition of a mucin-like material, PAS positive, often orientated vertically here in the dermis. You've got quite marked hyperkeratosis here as well. This is your epidermis here. But this is this vertical orientation of a lot of the eosinophilic deposits in the dermis. There's no effective treatment for this. These were these differentials that I spoke about: EPP, amyloid, scleromyxedema, colloid milium, the non-X histiocytoses. Okay, I hadn't really thought about those. Mainly EPP, erythropoietic protoporphyria, colloid milium. They would be the ones I would be thinking most of as a differential in these with this type of scarring on the face and exposed areas. No cure or effective treatment. Plastic surgery, dermabrasion, no systemic therapies. Scattered reports of the use of oral retinoids, D-penicillamine, dimethyl sulfoxide. And anticonvulsants if you happen to get involvement of your CNS. It's often the temporal lobe that's involved, and they have a characteristic calcification in the temporal lobes in this condition as well. Let's flick into another textbook here. Just see what more information we've got. Their picture here, I think it's probably very similar to the one that we've just shown there on that lower lip. Let's just have a look. Yeah, there we go. Look at those white deposits there. I think we've got better white deposits in some of the cases. Look at the bad teeth because of the xerostomia that they may get as well. Lack of saliva, and then you start to get plaque formation. You start to get bad teeth. And this was just other histology. I don't think we need to go into that. PAS positive because of the mucin material that's there. I think that's probably as much as I wanted to show you. Hyperkeratosis, some more of the waxy nodules, and so a quick glance at these again, because none of our cases have really shown them to any significant extent. Yeah, there we go. See, these ones aren't quite as hyperkeratotic as the ones that we showed in the other book there, but hoarseness, waxy nodules, it's just a spot diagnosis. If ever you see that string of beads appearance, so they're fairly smooth, these ones. Okay. Well, as I say, we're very fortunate in the Atlas to have many examples of a rarer condition like this. It's the other things that I've been able to glean from some of the books was that often you'll get deposition around salivary glands and hair follicles in this condition as well, and I think that leads partly to the alopecia that you may in fact get. There's often a thickening of the walls of some of the deeper blood vessels in the dermis as well, and it's made up of type 4 collagen and laminin that's increased around these vessels. The occasional patient can die of respiratory obstruction in infancy, but otherwise the disease is compatible with our normal lifespan. So, autosomal recessive, hoarseness in early childhood, waxy-like deposition under the skin, Initial vesicles followed up by ice pick or atrophic acne-like scarring on the face, hyperkeratosis over the elbows and knees at sites of trauma later, occasional presentation with epilepsy. And there you have lipoid proteinosis. So thanks to Namir, we have had the opportunity of seeing these 5 very interesting examples of this rare condition. Thank you very much.